We introduced repeat dispensing into the practice during the pandemic. It's fantastic for the practice and patients alike. It's a lot easier than having to phone up or call into the surgery, fill a form in and request your medication.
I'm Tim Binmore and I'm a GP and partner in Walker Medical Group. We saw it as an opportunity really to use the computer system to reduce workload and also to make life easier for our patients at the same time.
It's really easy for the practice, it's fantastic. When you're doing a normal prescription, you would have to issue 12 prescriptions per year. The patient just needs to contact the pharmacy when they think it's due, and then they'll be able to issue to the patient.
Once you press the button to prescribe, you're prescribing a whole year's worth of medication, and you're cutting out 11 or contacts with the practice for those repeats.
I would say the local pharmacies are well on board with what we're doing as a practice. We work together. It's something that they would prefer us to do as well. It's easier for them as well as us to do the repeat dispensing.
I'm Nisha, I'm the local pharmacist. ERDs are really helpful. You know, pharmacy is changing and it allows us to have a bit more ownership over helping patients get their medicines when they need to without actually disturbing the GP.
Pharmacists can make suggestions on changes if there's contraindications to medication, which we then pass on to the GP.
Benefits of ERD are that we can dispense medicines to our patients, you know, as and when they need to. If there's reasons that they need them early or later, without disturbing the doctor, we can manage that situation safely.
As soon as we started to use the system, we realised that there wasn't only just saving for the time for the GPs, it was the administration that was involved in the process, and also the benefits to the patient and the community pharmacists as well.
I would say the greatest benefit is to the patient rather than the practice. The practice, it's great for us as a whole, but for the patient, it's ideal.
I'm a patient. I take quite a bit of medication these days. Having had open heart surgery in 2011. The main reason I wanted to start using electronic repeat dispensing was really for the convenience. You've always got that assurance that there's another batch of medication when you need it.
If we didn't have repeat dispensing, it would be an absolute nightmare. I don't think we'd have enough hours in the day to, I mean, if you've got 6,000 patients and they all need a prescription, imagine how much time it would take.
And introducing the repeat dispensing has helped us immensely with that. I would say it's fantastic for anybody to have in the general practice.
So the biggest benefit for the practice, the patients and the pharmacist I see are time, efficiency and safety.
It's all about time. We spend less time signing prescriptions, we spend less time printing prescriptions. It really is a reduction in time spent on computers that we can do with more useful work instead.
I just can't believe that practices don't use repeat dispensing. We've used it for 15 years and it's just brilliant.